Hi friends, this is your friendly neighborhood pediatrician Dr. Aditya Bhatt, and today we'll talk a bit about nephrotic syndrome. So nephrotic syndrome is defined as a key disease of kidney having a nephrotic range proteinuria or a very heavy proteinuria. Now what do you define as a nephrotic range proteinuria? That is at least +3 on the dipstick positive, at least +3 proteinuria on dipstick positivity, or 1 gram per meter square excretion of protein albumin inside the urine, or a urine spot protein creatine ratio UPC ratio, which is more than 2 mg per mg. So that is the definition of heavy proteinuria or nephrotic range proteinuria. It is associated with hypoalbuminemia, which is hypoalbuminemia less than 3 gram per deciliter, and which leads to edema. There is also increase in cholesterol, hypercholesterolemia, but it is not a triad of nephrotic syndrome. Now, there is also loss of, as you know, that there is also loss of other proteins, so there is a derangement of coagulation factors also. Now, what are the specific definitions of nephrotic syndrome? So, remission of nephrotic syndrome is when the UPC ratio is less than 0.2, or urine protein that is nil on the dipstick for consecutive 3 days in the early morning sample. And relapse is when you get more than +3 urine on the dipstick and UPC ratio more than 2 on 3 consecutive early morning samples. Now, there are other definitions of nephrotic syndrome, like steroid dependence. So steroid dependence is that the patient has to relapse when on alternate day therapy, or within 2 weeks of stopping steroid therapy. That is the definition of steroid dependence. Now, frequently relapsing nephrotic syndrome is that there are more than 2 relapse in initial 6 months, or more than 3 relapse in later 6 months or the following 6 months, or more than 4 relapse in 1 year. That is called as frequently relapse. And steroid resistance is that after giving 6 weeks of daily therapy of steroid, the patient's dipstick is not getting negative, so that is called as steroid resistance. Now, what is congenital nephrotic syndrome? Congenital nephrotic syndrome is defined by any onset of nephrotic syndrome less than 3 months of age. The genes involved are NPHS1 and NPHS2, as you might know, the Finnish pattern and the mutations of nephrin. And so what do you do in the first episode of nephrotic syndrome? You usually do CBC, urine analysis, UPC spot ratio. You do this lipid profile, and you also do tuberculosis profile, in which you do MT and chest X-ray, because you have to start steroid. So that are the investigations that you do. Now, how do you treat the patient? So the current guidelines of nephrotic syndrome treatment state that you have to at least treat the patient for 12 weeks. So 6 weeks you have to give daily therapy, 2 mg per kg of prednisolone daily therapy, and then for other 6 weeks you have to give alternate day therapy of 1.5 mg per kg per day. Fine. So these are the basics of nephrotic syndrome. If you like this video, please like, share and subscribe. Further videos on nephrotic syndrome and the treatment protocols of nephrotic syndrome will be uploaded soon. And if you like this video, please like, share and subscribe, and thank you for watching.